Hi, everyone. This is Janet Hill of the Rock Island County Health Department. Thank you for joining us. It is 2:30 p.m. on Thursday, September 17th. Today, in addition to our usual public health updates from Nita Ludwig of the Rock Island County Health Department and Ed Rivers of the Scott County Health Department. Hi, everyone. This is Janet Hill of the Rock Island County Health Department. Resource and referral experts 2:30 talk about on navigating child care in the time of COVID and beyond. First of all, Nita, let's start off with some numbers. Thank you.
Good afternoon. Today, the Rock Island County Health Department is reporting 40 new COVID-19 positive cases, bringing our total to date to 2,789 cases. There are currently 17 people hospitalized in Rock Island County with COVID-19, and the death toll stands for Rock Island County at 74 deaths. We are seeing higher case counts this week, which could be associated with Labor Day gatherings. We have seen jumps in cases after every summer holiday this year. If you believe you have been exposed or know that you attended a gathering without taking proper precautions, please get tested. There is a state-run testing site open 9 a.m. to 5 p.m. every day through this Sunday at the Quad City Expo Center in Rock Island. Any Illinois resident, regardless of symptoms, can get a free test at that site. Thank you.
For Scott County, today the Iowa Department of Public Health reports 2,612 cases. They have also reported the death of another Scott County resident, bringing our total to 27. Our deepest sympathies go out to the family of this individual. As a community, the challenges related to COVID-19 just keep on coming. On both sides of the river, families with children are dealing with the difficulties of responding to a new school schedule, taking on the role of a homeschool teacher, navigating the world of technology and connectivity, balancing job responsibilities and schedules, and also finding safe ways for caring for their children while they're not in school as usual. For many families, this is not only a scheduling issue, but a financial and safety issue. We're fortunate enough to have dedicated programs in our community that are responding to the needs of families in these unique times. Child care resource and referral programs in Scott and Rock Island counties are champions for families, and we're fortunate to welcome staff from both programs on the call with us today.
Thank you, Ed and Nita. So today we do have two of our child care resource and referral community partners on the call. They will be using some slides to share some information with you. So first we'll hear from Becky White, Regional Director for Child Care Resource and Referral of Southeast Iowa, and that's through Community Action of Eastern Iowa.
Hello, good afternoon. My name is Becky White, and I'm the Regional Director for Child Care Resource and Referral of Southeast Iowa. So I'm here today to update you on some of the information and data about child care programs in Iowa and how they've been affected by COVID-19. So Iowa DHS continues to provide updated guidance to child care providers to ensure the health and safety mitigations is taking place within the child care settings. This has continued to evolve over the last 6 months, and currently, here's some of the current recommendations that came out in August. So currently, adults and children school-aged are encouraged to wear face masks to help limit the spread of droplets. Other younger children over the age 2 are also encouraged, but they've put a stronger emphasis on that school-aged child. The programs are using social distancing by reducing class sizes and limiting the number of people allowed in communal places at one time. So for example, this would be on the playground or in hallways to make sure that program or classrooms are not, moving into those communal places or spending time together. Though the class The class sizes through the summer were limited to no more than 10 in a class, but that has been lifted and is based more on room capacity. And so centers are encouraged to evaluate the room capacity and making sure that programs or children and teachers can socially distance within that classroom. There's other mitigations then that are emphasized, including frequent hand washing, cleaning of materials, minimizing the sharing of high touch materials. So for instance, toys that maybe are frequently used, having additional sets of those or additional materials available. Another high touch item is food preparation. And so making sure that programs are planning and being prepared to serve food individually to children. So normally pre-COVID, we would encourage family style and passing the food and those self-help skills of serving yourself. And those are kind of a thing of the past at this point. So really encouraging programs to be planful and make those mitigations. One of the big questions that comes up is about what happens if there's a positive case or exposure to a person who has tested positive. So the Iowa Child Care Nurse Consultants and the Department of Human Services, DHS, have provided some guidance to programs which includes basically contacting that nurse consultant to share the situation and ask for additional guidance and directives. So programs with an identified case or exposure would follow the CDC guidelines. Those individuals that had close contacts would be asked to quarantine if they were, in that close contact with persons that had tested positive or had been exposed. And then DHS provides some additional steps that programs can take to make sure that they are being preventative. They do make the determination to close programs if there is multiple people testing positive or a situation where they believe that, that there was a widespread close contact. Many programs we're seeing are taking that step if they do have someone who tested positive, that they're closing for a few days to deep clean and ensure that all precautions are taken and that they're ready to reopen. Childcare continues to be a need in our community. So with school programming returning to hybrid or remote learning, families are looking for childcare for non-school days so they can continue to work and provide for their families. Once again, providers, both homes and centers, have stepped up in attempts to fill these needs. They've adapted their enrollment, created age-appropriate activities for school-age children, and many have helped create solutions for virtual learning. So though many programs have school-age children normally in care, they are not prepared to provide full-time care year-round because the children are typically in school. So that's taken a lot of adjustments. Virtual learning has created many barriers, such as internet access, supervision of when those children are online, making sure that they're looking at the right content and following their lessons, and then the need for teaching of that lesson or school-age curriculum. Again, our child care providers' experience and expertise tends to be with infants, toddlers, and preschoolers, especially when it comes to that education tool, whereas school is that primary teacher for those school age. This has been a stressor for the childcare community, but providers continue to try and meet the needs of all the children in their care. And that's kind of the key, is they step up and know that they try and figure out what's best for that child. Families looking for care for school-age children or any other ages are encouraged to call our parent referral services. So the number is on your screen. Similar to Illinois, our parent specialists gather information based on the family's needs, including ages of the children, hours of care needed, and location preferences. Based on the gathered information, we provide parents with a list of possible childcare programs, as well as information regarding the selection of quality childcare, and give them some questions that they should ask programs when they're trying to find a provider that meets their family's needs. There is also a resource online that shows childcare programs and vacancies created by DHS in conjunction with Child Care Resource and Referral. And this is to help families and communities identify availability. So this is kind of a screenshot of what the map would look like, but you can zoom in onto specific areas to see how many vacancies are listed in there and what programs. So Scott County had 297 total programs listed with Child Care Resource and Referral in July of 2020. That is compared to 312 in July of 2019. This includes the The number for July 2020 includes approximately 40 programs that remain closed at the end of August of 2020. So those are programs that closed due to COVID back in March and are temporarily still closed. Some of those programs may have opened up at the beginning of September with schools opening, and so those numbers will be reflected at the end of this month. Others are unsure if they will be able to reopen and what that looks like for them. The last thing I wanted to share with you today is just about the need for support of our childcare programs. Iowa had already lost 40% of childcare programs over the past 5 years, so that's looking at 2014 to 2019, including 40%, the same statistic in Scott County. So now more than ever, our childcare programs are struggling to stay open. So on top of that loss, we're concerned about programs that maybe aren't able to stay open or will not be able to reopen after this pandemic. We did a recent phone survey, as did Illinois, and April can share that, but some of the programs in Scott County area, and they have continued to express worry over financial needs of their program with reduced class sizes and higher expenses for things like cleaning and staffing. They express concerns about the amount of income compared to the amount of costs running their programs. And that is for both centers and homes. Additionally, they're struggling to find the staff to care for the children within the programs. And this has been noted by the programs to be due to fear of providing direct care during the pandemic. So finding staff that maybe didn't want to return to work or feel like they are unable to due to their own health concerns, as well as hiring new staff into the field has become difficult. Other reasons for that have been staff or potential staff needing to be home to help care for their own children and their own children's learning. So I thank you for your time today, and I appreciate your interest in childcare and the children in our community, and am happy to answer any questions that you have and gather that information. Thank you.
Thank you so much, Becky. We really appreciate you sharing that information representing the county. And now we are going to hear as well from our other resource over in Illinois. This is April Berthium. I don't know if I said that correctly. I apologize. I should have asked you first, but Child Care Resource and Referral Director with SAL Family and Community Services. So please go ahead. Let's get you unmuted there really quick, April.
Thank you. We were both trying to unmute me at the same time there. Thank you. Good afternoon. My name is April Berthium. I'm the Director of Child Care Resource and Referral of Midwestern Illinois, located in Moline. This afternoon, I'm going to just talk with you a bit about this response of Illinois within respect to the COVID-19 health crisis, including some measures that the state has taken, current regulations and guidelines that are in place to help ensure health and safety, and also some additional resources that our office does provide here. I'm Child Care Resource and Referral of Midwestern Illinois. Our office is located in Moline, Illinois. However, we do serve a 7-county area here in the western area of Illinois, Rock Island County being one of those. Our services include child care assistance program management. We do welfare provider services, some various grants and programs, and we also do parent referral services. Information here around just a little bit of background on Illinois' response to the COVID-19 crisis. Included in Illinois Governor Pritzker's March 21st emergency order was the closure of all licensed child care centers and homes.